Hello, good afternoon. I'm Professor Jayakar Thomas, Director of Dermatology at the Chettinad Hospital and Research Institute, Chennai. Now, I'm just going to give a few words on psoriasis. With the World Psoriasis Day around the corner on the 29th of October, I thought a few words of counseling will definitely help the patients with psoriasis. First of all, how to diagnose when you get white, silvery scales, mostly over the scalp, over the elbows, and front of the knees. Please visit a dermatologist, please. Don't wait till the patches become worse. And having done that, kindly take every effort to follow what the dermatologist has advised, particularly in terms of the investigations, the blood tests that has to be done. Having done that and making sure that you do not have any other condition, what we call as comorbid conditions. You should not be having any other conditions along with this, which is so common for us to see in psoriasis. Therefore, it becomes important that certain minimum investigations, they're not going to be costly at all. Minimum investigations, blood tests have to be done. Having done all this, the most important part is follow the advice, not necessarily medical advice. Medical advice is easy for you to pop in a capsule and put in some ointment. Please follow the paramedical advice, that is, in terms of the challenging times that we have to look at the lifestyle modification. I always impress upon the patient, particularly the younger boys and girls, people who are in the teens and the early 20s, going to school, going to college. They are the ones who have to be advised, particularly on this. Avoid eating outside the house. That's the best thing. So instead of saying, avoid this, avoid burgers, avoid cakes, avoid pastries, avoid eating outside the house. Eat only home-cooked food. That's it. And also tell the parents, do not encourage eating outside. Do not give them funds to eat outside. The second thing is, make sure that you do not put on weight, the young chaps particularly. Couch potatoes. Go to school and college, come back home, just sitting on the sofa with a remote control in front of the TV or in front of the system, and just couch potatoes, because they should not be doing that. They should not be doing that. They should go in for mild exercise. They don't have to do any bodybuilding exercise. Mild exercise is a rule rather than an exception. They have to do it. Simple, little bit of jogging, little bit of skipping, whether it's a boy or a girl. No, you can do it. No point in saying, I don't have enough space in my area. Do it within your house. They say what is known as a figure of 8. Just walk within your house in the form of figure of 8. You get your exercise. Then, of course, your medications, which the doctor will prescribe, depending on the degree and certainty with which one needs. That would be a few words of wisdom that I would like to tell my psoriatic patients. You will all be well. You'll all be perfectly well. You'll all study well, and I'm sure everything should be well. Thank you.